everybody, it's Dr. Kimber, and I'm so excited to be back with you today. It is Wednesday, and so we get to be together. We get to talk about your health. You get to ask me any questions that you want to ask me so that you don't feel like you're in this journey alone. However, hormones affect us as women, and therefore they affect the men around us. So I'm sure that if you're a man and you're listening today, maybe you're listening for the woman in your life, and you can pass some of this information on, or maybe just understand them just a little bit more. So here's the thing. If you've been struggling with things like PMS, mood swings, breast pain, low libido, hot flashes, or brain fog, it could be related to your hormones. So you want to tap into this. I will tell you that there are more women who go to the doctor complaining of a symptom, whether it be pain or low libido or brain fog or fatigue or weight gain or whatever, that has to do with hormones. And if you're getting told that there's nothing wrong with you and they didn't check your hormones, then maybe you're not in the right place. But I'm going to tell you right now, you're in the right place, because we're going to dive into this a little bit. I just really want to give you a broad look. If you follow it all on any of the shorts that I do or any of the posts that I make, you'll see that I'm kind of been talking about hormones lately. And I think that it's become a major passion for me because I see so many patients that come to me and their hormones are not balanced. And I'm talking sex hormones, I'm talking thyroid hormones. We're having major issues and they're not getting anywhere. And it just drives me batty because it's not a hard fix. We can do something about it. There's lots of things. There's supplements. There's natural hormone creams. There's lifestyle. There is a lot of things that we can do. And so I just really want to be a voice out there for everybody that's suffering, myself included. I suffered with low hormones and I didn't even know exactly what they were. I didn't know they were low hormones. Actually, here's my story. At 37 years old, I had a hysterectomy. All right. I wish I would have done things differently. Didn't know then what I know now. I thought I immediately went through menopause when I didn't have a bleed anymore. But the truth is that even though I didn't have a bleed, I hadn't gone through menopause. I didn't go through menopause until the last couple of years. I had these random things popping up, like back pain. I had this back pain that would not go away. No matter what I did, I went to physical therapy. I went and saw my doc because I was desperate. They wanted to inject. I said no. Physical therapy didn't help. Chiropractic didn't help. What was it? So I started to dive in deeper into hormones, and I realized that it was low estrogen. Did you know that low estrogen can cause pain? It can cause back pain, right? So I ran a full panel, hormone panel on myself. I did this a year ago and I was tanked. My hormones were absolutely tanked, like zero. I mean, I had some because you have to have some, but like kind of emergency tanked. So I talked to a friend, a DO partner friend that, what do I do? Do I go, and so I started looking into some different things naturally and whatnot. I decided that before I was going to try anything drastic, like any hormone pellets or whatnot, I would actually put a protocol together, a natural protocol with lifestyle, with foods, with, I was going to put a protocol with supplements and using some natural hormone cream. So I was going to put that together and I was going to see where I landed. Well, I'm happy to report that just recently, a couple weeks ago, I did my full blood workup again, found out that my hormones are absolutely optimal. But here's the secret. I knew they were. You know why? because my pain started to go away. And other things like vaginal dryness was getting better. And just my breast tenderness, I didn't have that anymore. I saw my body coming back to change. Now I will tell you, I also started getting a few pimples here and there, and I was like, okay, bring it on. Hello, my hormones are waking up again. And I dealt with that. But that was the exciting thing, is that what are back to where they should be, in a really good, healthy range. So I want to dive into and help you understand a little bit more about hormone imbalances and what causes some of those hormone imbalances. So we often tend to focus on estrogen and progesterone a lot, right? Those are the two sex hormones. Testosterone is the other one. But your hormone health does evolve around so much more than just progesterone and just estrogen. A lot of women experience imbalances like I was experiencing. Maybe you're experiencing it too, but the root cause isn't always about the hormones themselves. So that's the first thing we have to remember. And so we're going to dive into some of the things that cause your hormones to get out of balance, because maybe, just maybe, you aren't 56 years old like I am and going through or have gone through menopause. Maybe you're 35 years old and you are perimenopause. Maybe you're 40 years old and you're premenopause, right? So maybe you're still cycling, but you're having these really awful periods, super bad PMS, super bad mood swings. So what is that all about, and why do you have a hormone imbalance going? So if you come to see me as a patient, the first thing I'm going to do is I'm going to test your hormones, because we have to see where your hormones are at. That gives us a very clear picture. All right. But then we're going to dive into, after I get that test back, that test is going to show me your liver health. That's going to show me your gut health. It's going to show me some of your blood sugar imbalances, where your cortisol is at. So it's going to tell me a story about your stress. So it's going to give me a really clear picture of where you are at. So remember, this is very bio-individual. It's all about you and your body, not about your neighbor. So what worked for your neighbor might not work for you, okay? So we're going to look at 6 different things, that can be causing a hormonal imbalance. Detoxification is one of them. Gut health, stress, blood sugar imbalance, nutrient deficiency, and xenoestrogens. So I'm going to dive into those with you just a minute here. Okay, so let's talk about detoxification first. So your liver, now you've heard me talk about this. Your liver is where estrogen is metabolized. That's where it gets broken down. So the truth is that if your liver is sluggish, if it is not working optimally, your estrogen is not going to get broken down, and you can have a backlog of estrogen, an excess of estrogen then that develops. All right? Something you do not want. So it's very important that your liver is working optimally. It's draining optimally. We don't have things like toxins and parasites making your bile sludge, or liver flukes that can clog up the liver and not make the toxins move through it, or the hormones move through it. So that is one of the things we're going to look at and we would discuss with you, okay? Estrogen can build up in your body if it can't get out. It's like anything else. So we've got to make sure that your detoxification is in check. The second thing is your gut health. Estrogen metabolites are eliminated through your bowel movements. So if you are not having 1 to 3 toilet filling bowel movements every day, you are building up those estrogen metabolites again in your system, and that is causing an imbalance in your hormone pathway. All right, so it can affect your progesterone and your estrogen balance, your testosterone. It can even affect your thyroid and all the hormones with that. So it very much is necessary that your gut health is in check. The third thing is stress. All right, chronic stress pushes your body to produce cortisol, and cortisol is an inhibitor to progesterone. So what can happen when your cortisol is nice and high, your progesterone drops and your estrogen becomes dominant again. Again, that is one of the ways that we have this hormonal imbalance. Okay, the fourth thing is a blood sugar imbalance. So if you have high blood sugar levels, so that sugar comes back around to bite us in the butt, right? If you have high blood sugar levels, so you have some insulin resistance going, maybe it's really hard for you to lose some weight, that's a good indicator you have insulin resistance. Or you have a lot of cortisol, you have a lot of stress that pumps that blood sugar up. That blood sugar, a high blood sugar level, actually reduces a hormone called SHBG, which is sex hormone binding globulin. When that gets reduced, you have a likelier issue with high levels of free estrogen and free testosterone. Because you see, you need that sex hormone binding globulin to bind up that estrogen so that it's not free flowing and in excess of your body. It binds it up and it helps to move it out. Okay, it utilizes it and then it helps to move it out of the body. All right. So then the fifth thing is nutrient deficiencies. Almost all of my female patients that I work with, I put on magnesium and vitamin B6. Why? Because they are essential for hormone metabolism. All right, so you may have some nutrient deficiencies going on. And then the sixth thing is xenoestrogens. So what the heck are xenoestrogens? Well, xenoestrogens are fake estrogen. They are found in chemicals like plastics, beauty products, and even some of your food packaging. They mimic estrogen and they disrupt your hormone levels. All right, so they're endocrine disrupting. They block your estrogen receptors so that your estrogen cannot connect to the receptor that it needs to connect to. So it creates this really wicked imbalance there. So how do we deal with that? Well, we take a look at your lifestyle and what are you using? What kind of personal care products are you using? How are you storing things in your kitchen? What are you drinking out of? Did you know, I have a metal, or what is it? A clean cup to drink out of, right? But if you grab a coffee cup from Starbucks or a coffee house like that, you run the risk of that heat from that coffee, that hot coffee, absorbing the plastic that it is lined with. And it's lined usually with bisphenol A, which is BPA, right? That's an endocrine disruptor. So also, if you are a meat eater and you love to eat meat, and you especially love to eat the fat on meat, like a ribeye steak, and you like that fat, I personally don't like that, but I have family members that do, then that, if it is not a hormone-free cow, you are getting excess estrogen in that fat. So it could be down to what you eat that you're taking in this excess estrogen as well. All right, so when we work together, we look at all 6 of those things. Do any of those surprise you? Put in the comments if any of those 6 things that can disrupt your hormones surprise you. I see that Ellie is here with us and she is listening from Iowa. Hello, Ellie. It's great to have you. So, Ellie, did any of these 6 things that can disrupt your hormone pathway, were you surprised by any of those? Let us know in the comments. All right. So, I briefly talked about how your hormones change over time, and you have different stages in your hormones in your life. But I want to dive into a little bit more about how hormones change over time, and I want to make sure that you understand where you might fit into there. Tamra, you're listening from California. Hello, Tamara. Great to have you on. And you drinking straws. Yes, I know. Isn't that terrible? So carry your own little metal drinking straw so that you don't get the heat absorbed from your drinking straws or the toxins absorbed from that. And Ellie says you didn't know that the fat of meat held more estrogen. Yes. Sadly, for those that love like their ribeyes and whatnot, it does. So you can still have that fat. Just make sure you're eating hormone-free, grass-fed, clean meat. And then you can have all that fat on that ribeye if you really like that. Okay? Teresa is here listening from Florida. How are you doing in Florida, Teresa? We've been thinking about our Florida friends with all the hurricanes out there. Hopefully you are doing okay. All right. All right. Let's dive into just a little bit more. I want to break this down a little bit more for you as far as how your hormone balances change over time. All right. So first of all, our hormones are different, whether we're 25 years old, we're 35 years old, 50 years old. They're different, okay? Typically, under the age of 40, we call that pre-menopause, all right? If you're that pre-menopause time period typically happens, around 40 or just under 40. At this stage, you usually still have a regular monthly period. But one key imbalance, if you're coming to me and you're saying my hormones are out of balance, maybe you're dealing with some heavy periods, breast tenderness, mood swings, bloating, things like that, one thing we would check for is estrogen dominance. That is typically what happens at that stage. Is pre-menopause, you tend to get this big surge in estrogen dominance, and that's when, in comparison, your estrogen is much stronger than your progesterone. Okay, so just to kind of spell that out a little bit, they should be, in range of each other. And again, some of those symptoms are heavy periods, breast tenderness, mood swings, bloating, weight gain, weight that doesn't move. All right, so those are some of those symptoms with pre-menopause. So if you are around the age of 40, or you're having some of those symptoms, that you might be in that pre-menopause. Now there's also perimenopause. Now perimenopause can happen as early as 30, 35 years old. And you can be in perimenopause for, 4 years if you're, around the age of, 50, or you can be in perimenopause for 10 years. Okay, so there's a wide range of perimenopause. And this is when your hormones are fluctuating wildly. Like your cycles can become irregular. They can be 1 month, they can be 14 days. The next month they can be 28 days, your cycle length. They are all over the board. And commonly, some of your symptoms that you might have are things like insomnia, headaches, anxiety, not to mention those really irregular periods. So what do? Well, we test and we look, and what what we typically find in that case is that you're very low estrogen. Now, you could also be you're very low progesterone. You could also be high estrogen, but typically, when we add just a little bit of estrogen or progesterone in at that time, we see some of those symptoms resolve, okay? But we also have to take a look at those hormones and see where the balance are. If the estrogen is super high, progesterone is super low, what it all looks like. But usually that's a progesterone issue, okay? The third stage that we walk through is post-menopause. Now, menopause, let me just pause here. Menopause is the year that of this random, like you might have a period and then not again for 3 months. And then you might have a period and then not again for 6 months. And then you might have a period and then it might be 2 months. And then you might have a period and it might be 8 months. Okay, so that's menopause. Post-menopause is when you have not had a period for a year. So 1 year without a period puts you into post-menopause. You've arrived into post-menopause. What are some of the signs of post-menopause? They can be of menopause as well. Night sweats, hot flashes, headaches, vaginal dryness, pain with intercourse. You can also gain weight, especially around the midsection. And a lot of times when I talk to patients, they'll be like, "Well, I haven't changed anything," but you start to gain weight. It's because your metabolism is lowering, okay? So that is what we call post-menopause, is when you've not had a period for a whole year. During that time, you can still have some of those symptoms and be in menopause. So those are also times where you want to reach out, because it doesn't have to be miserable. I got on top of mine. I have no issues now, none. All right. So there is hope if you're struggling with your hormones. Jeff, great to have you. You say toxoplasmosis is more than likely the cause. Yes, toxoplasmosis can absolutely mess with your hormone pathway. Absolutely. So we go after that. We do not rest until we find what is causing those hormones to be out of balance. Teresa, I am glad to hear that you are all good. That is awesome. All right, if you've got some questions, go ahead and drop them into the comments, because I know that hormones, that topic, can be really confusing and in depth. And a lot of times, if you've gone to the doctor, you can walk away feeling like it's just all in your head. And I just want to really assure you, it's not all in your head. So don't believe that. There's something going on, and we get to the bottom of that. All right, so regardless of your age and what stage that you're in, let's talk about some practical steps that you can take to really balance those hormones out. So we're going to finish up here with some of these practical steps, because I want to leave you with some tools. First, you want to make sure you're eating high quality protein and healthy fats. Healthy fats like omega-3. So a lot of your fish are going to have your omega-3s, so you got to get those in. Get those healthy fats. Avocados, walnuts, those are all good healthy fats. Protein. You've got to eat your body weight in ounces of protein a day, or at least your ideal body weight. So if you are 300 pounds and you wish you were 150 pounds, then eat 150 ounces of protein a day. Divide that up over 5 times throughout the day. Okay? Why? Because those are your building blocks for your hormone production. Okay? You need those. Second, manage your stress. I know that's so much easier said than done. I get it. But you got to keep that cortisol level in check. For some, it comes down to having to monitor your blood sugar by getting a continuous glucose monitor. Those can help you if you just don't know where the stress is coming from, can't seem to get it under control. A continuous glucose monitor might be the thing for you. All right. Learn some techniques to manage that stress. We do that together. Third, support your liver health. Your liver is super important. Do not ignore it. Do not let anybody else tell you that it is not. It is absolutely important, and you need to make sure you're getting enough antioxidants into your body. You need to make sure that that liver is supported for healthy hormone metabolism. Next, optimize your gut health. All right, you need to make sure you're pooping 1 to 3 times toilet filling a day. If you are not, you need to add some fiber or some probiotics or anti-inflammatory foods, or you need to reach out because you need to get on top of that. And finally, engage in some resistance training. So if you do not have a gym membership, you do not have time to get to a gym membership, or you do not have resources for a gym membership, then use your body weight. You can lay on the ground and do push-ups. You can do push-ups against a wall. You can do deep knee bends. You can do squats. You can use your body weight as resistance training. The key is to do it. All right? So, what stage are you in right now? Where are you at with your hormones right now? How are you doing? How can I help? Let me know. Your hormones rule your life, and they determine the quality of life around the people around you. So I want to encourage you to not ignore them. They are not just going to go away. They are going to keep speaking to you and keep being bold and keep being loud. So that's it for today. Thanks for joining me, and stay tuned for next week as we gather again to talk about another health topic that hopefully you find near and dear and very beneficial. It's great to be with you. Have a great day, everybody. Bye.